Can an L4-5 disc bulge ever fully heal? And just how long does a bulging disc take to heal? If you're struggling with an L4-5 disc bulge or back pain that's stopping from doing even the simplest things like sitting, bending, or putting on socks, you might be wondering, can it ever heal? Will I live with this forever? I'm here to tell you there is hope. For over 30 years, I've helped thousands of patients recover from disc injuries like yours without surgery. In this video, I'll answer the big questions: can an L4-5 disc bulge heal? And how long does a bulging disc take to heal? And I'll break it down in a way that you've never heard before. Plus, stick around and I'll reveal a revolutionary treatment that combines two research-based therapies that accelerate healing of an injured disc. I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link pinned in the comments below. Before we answer the big question, can an L4-5 disc bulge heal, and how long does it take for a bulging disc to heal, let's first understand what a disc bulge is, what causes it, and why it's so painful. So what is a disc bulge? Well, a disc bulge happens when one of the discs between the spine's bones, these are the vertebrae, pushes out of its normal shape. So this is not a slip disc. This is often what you're told. Discs don't really slip, but doctors often use that term because they think it's an easy way for patients to understand what's going on. What really does happen is that if a disc has pressure on one end, what's going to happen is you're going to see a bulge come out on the other side. Okay? Think of it sort of like that jelly donut. If I squish it on one side, it's going to bulge out on the back that way. So when that happens, the biggest thing the discs actually do is they allow for space for these nerves to come out. And so if you have a disc bulging on that, you're going to impinge that nerve. You're going to actually lessen that space. They also act as shock absorbers. So when they weaken or face too much pressure, they can bulge outwards, pressing against those sensitive nerves and other areas around the spine. So then why does it cause so much pain? Well, your spine is packed with nerves. That's how the brain communicates with the rest of the body. So when the disc bulges, it can press on those nerves, causing sharp or burning pain. The disc injury itself also triggers inflammation, which irritates the area even more, making the pain feel constant and even severe. And what causes a disc bulge? Well, really anything that puts pressure on it. So as we talked about before, think of the jelly donut. If I squish a jelly donut at the front, it's going to bulge out at the back. Okay? And so that's why you want to avoid movements like sit-ups, things like that, because that's actually just going to make that worse. So when we talk about putting pressure on the nerve, that can be a number of different things. That could be, number one, any type of repetitive stress or poor posture. So that's a small amount of pressure, but it's over a prolonged period of time. So sitting too long, improper bending, it can wear down discs over time. Like I said, not a great deal of pressure, but think of how long we sit. Think of the chronic postures that we get into. Number two is the exact opposite. Number one was a small amount of pressure over a long period of time. Number two is a great deal of pressure over a short period of time. So any type of injury or trauma, sudden movements of heavy lifting can strain the spine and cause bulging. Car accidents are notorious for this, where they'll actually weaken that disc and eventually you will create herniations even down the road. And then number three, there is age-related wear and tear. Now, normally, I'm usually not a fan of blaming things on age. It's really what we do or what we don't do over that time. But as we age, discs will lose their water content and their flexibility. A disc is more prone to injury, obviously, if it loses that water content. Normal discs are supposed to be 86% water, and unfortunately just drinking more water doesn't put more water back into that disc. Now, if that bulging disc presses directly on a nerve root, so that's where the nerve comes out of that opening, what we call the foramen, like the L4-5 spinal nerve, it can cause symptoms beyond your back because it's going to affect wherever that nerve goes to. So that can be pain radiating down the leg and into the foot. That can be tingling and numbness. That can be weakness in certain muscles. And remember, if it gets really serious, those same nerves go to the bowel, the bladder, the reproductive organs. They'll affect your sexual function. This condition called radiculopathy explains why disc bulges can impact the entire body, the leg, the foot, not just your back. Now that you know what's happening, let's dive into the big questions. Can an L4-5 disc bulge heal, and how long does it take? The first thing I want you to know is there is hope provided you're doing the right things. Whether you're dealing with a new disc injury and acute symptoms, or whether it's a chronic disc bulge that's been causing problems for over 6 months, many cases can be treated without surgery. The goal of conservative care is simple. You want to quickly relieve the pain, you want to restore normal movement and function, and you want to avoid surgery altogether. Over the years, I've helped thousands of patients with disc bulges or herniations using non-surgical methods. Often they initially come to a clinic after trying all other kinds of therapies without success, yet they have recovered successfully when they've actually done our non-surgical treatment protocols. So if you've tried different drugs, injections, physiotherapy, chiropractic care without success, don't give up. There are many reasons why treatments may fail. That's a topic for another video. But right now, I want you to know there's still a path forward. In a moment, I'll share the revolutionary treatment that we offer to our patients, one with over a 90% plus success rate in treating disc bulges, herniations, and associated back and leg pain. But now, let's discuss, can an L4-5 or an L5-S1 disc bulge heal? The answer is yes, but it takes time and you need to have the appropriate care over that time. The body has this incredible ability to heal, but that's provided that you're giving it the right tools to heal. If you're not giving it the right tools, it's just going to continue to fester. I want you to think of you at the top of a roller coaster, and remember the only way to coast is downhill. So we can't coast, we need to take the appropriate steps to actually allow the body to heal. Then the next question that patients have is, how long does it take? Well, this is where most people get very impatient. A lot of people we see have had their problem for 10, 20, 30 years. That's not going to change in 3 days. A good analogy would be putting dental braces on. If you have crooked teeth, those braces are going on for 2 years, and they actually literally have to attach wires to your teeth. And what happens when the wires come off 2 years later? Then you still have to wear a retainer for another 2 years. So understand, it does take time, not the 2 or 4 years that dental braces take, but it does take time. Based on the science and the protocols that we do, is it typically takes 12 weeks to actually get a disc to heal properly. And the truth is, if we're looking at full restoration, this is straight out of Guyton and physiology. Guyton's considered the Bible of physiology, is 12 months for soft tissue to heal. So this, of course, also depends on how long have you had it. Is the disc injury something that only happened a week ago, or is this something that's been building for years and years and years? Obviously, those are going to involve different timelines of healing. But what you need to do when we talk about the proper care, number one, if this was caused by all this pressure on the disc, you need to take the pressure off the disc. So there are many ways to do that. A lot of forms of care don't really do that. They're trying to, manage the inflammation, manage the pain. Managing something is not the same as actually fixing it. So that's often why the approach doesn't work. So number one, you need to take the pressure off that disc and off that nerve. Number two is you need to rebalance the spine. So think about it. If it was posture abnormalities and chronic work postures that created this in the first place, if you try to fix this disc and yet you still have all these imbalances, then that's going to be an issue. You're just going to bring the problem right back again. And this is not just strengthening, this idea that, just go strengthen your core and the world would be better. For those who don't know my background, I've dealt with some of the world's best athletes. I'm a bigger fan of exercise and core strengthening, yes, but what you need is a strong, straight, balanced spine, not a strong, crooked spine. There's a huge difference, with that. You need the proper nutrients because those discs require nutrients to heal. The body's capable of producing some of those nutrients. It typically stops doing that about age 40. So for any of these people who believe, well, I just need a good diet and I'll be fine, it's a nice thought. It's wishful thinking. It's simply not true. It's one of the reasons why you still have your problem. You can't get enough nutrients out of a normal diet to fix this type of injury. And then last but not least, we've talked about this, is you need to rehydrate that disc as well. Remember, the disc is supposed to be 86% water. Most people who've degenerated that, who have some type of bulge or herniation, they're nowhere near that. And again, you don't get this just by drinking more water. That's where our robotic laser spinal decompression is the ideal form and really the only form of care for that. One of the things that makes us unique and different is that treatment system called non-surgical robotic laser spinal decompression. There are only 12 systems in the world. We're proud to have the only one in Ottawa, Ontario. This is a patented system. Essentially what robotic laser spinal decompression is if you have all this pressure on the disc, what makes more sense than to take the pressure off the disc? That's what spinal decompression is supposed to do. A lot of standard spinal decompression still doesn't work. It's still far more advanced than traction or inversion. So it's been combined with simultaneous class 4 deep tissue laser that allows true spinal decompression to happen, which creates a vacuum effect that's going to pull nutrients back into the disc, going to rehydrate that disc, plus give you long-lasting relief, and it's going to actually help to heal that damaged tissue in there as well. So that's the nice thing with our robotic laser spinal decompression. It's all part of what's called a neurospinal restoration program. We look at all the pieces of the puzzle. But if you want to know more on that, we have a number of different videos that you can watch on my channel. The purpose of this video was to give you a deeper understanding of disc bulges and injuries, provide hope for recovery, explain how disc healing and recovery times work, and introduce you to non-surgical robotic laser spinal decompression as a treatment option. I truly hope you found value in the video. If you did, please like it and share it so people struggling with back pain can find the help they need. And if you have any questions, drop them in the comments below. I'd love to hear from you and help in any way I can. And don't forget to subscribe if you're looking for more proven tips on strategies to treat and relieve debilitating back and neck pain without relying on drugs or surgery. The next video you should watch is this one right here, where you'll learn all about our 7-step non-surgical treatment method for disc bulges, disc herniations, sciatica, stenosis, and other spinal degenerative disorders. Please go watch the video here.